At this ASH meeting, we also provided an update for the DREAMM-2 clinical trial, specifically concentrating on some of the patient-reported outcome that we collected during this study. Now, it's really important to understand what patients experienced during this study, as it adds a different dimension to some of the toxicity data that we've been understanding. And so there were two main areas that we investigated. First of all, we performed various quality of life questionnaires. And then secondly, we also interviewed patients and we obtained transcripts to try and understand how they were getting on. To begin with, I'll start off with the questionnaires that we performed, and patients underwent a number of different questionnaires that they completed every 3 weeks during the clinical trial. We did the standard EORTC HRQC30, which is the standard cancer quality of life questionnaire, and we also did the myeloma subset, which is the MY20 questionnaire. But because we know that belantamab mafodotin causes a number of ocular problems, we also performed two ocular-specific questionnaires, namely OSDI, which is an ocular surface disease index, and also a more global way of looking at eye function, which is NEI VFQ25. So these were performed, as I said, throughout the treatment of patients, and we also performed questionnaires at the end. In summary, what these demonstrated was that the global health status of the patient was maintained during the clinical trial. So what we didn't see was any significant deterioration of their global health whilst receiving this drug. And so that's important, that there wasn't any significant detriment due to this treatment. But what was, I think, more interesting is that when you focus into some of the specific domains within the HRQC30 dataset, we saw significant improvements in fatigue, physical functioning, and pain. And I think in general, it's normal to see stabilization of these events, and it's unusual to see an improvement in these quality of life specific domains. So I thought that was quite encouraging with this treatment. Now, because of the known ocular side effects, we also focused quite a lot upon the OSDI. And what was interesting about the OSDI is that we asked patients when they first noticed the ocular symptoms, and the time at which they reported that was very similar to the time that we noted reductions in visual acuity on ophthalmology exams. So there's a good concordance between the patient-reported deterioration in their visual symptoms and the observed deterioration in visual acuity. So we decided to focus on those patients who had a significant reduction in their OSDI visual functioning, just to try and understand if that impacted upon their overall global quality of life. So we looked at the HRQC30 subgroup for those patients who had a deterioration in eyes function. And what was interesting was that even though their eye function wasn't so good, their general physical functioning, their role functioning, and their global health status remained the same. So what we understand from that was that patients were still functioning at a good level despite having a reduction in their quality of vision. We then asked and investigated patients who had difficulty in driving because of reductions in their visual acuity. What we noticed was that 23% of patients reported that they were unable to drive at any point during their treatment due to belantamab mafodotin. What we did see is that a significant proportion did return back to driving, and another proportion of patients, that's 9 patients, did not. However, of that group of patients that did not return to driving, a number of them didn't actually return back for their follow-up, so we're unaware whether or not they were able to return to driving or not. We did go back to their visual acuity scores, and we did notice that their visual acuities had improved, so one would anticipate that they would be able to return back to driving if possible. I should also point out that it was really interesting that when we asked patients before they started treatment, that actually only 74% of patients said that they were able to drive because of their eye function. So clearly 28% of patients couldn't drive because their eyes weren't good enough even before they started having treatment, which I think is quite interesting in its own point. We also looked at the number of patients who had problems reading because of this agent, and we noticed that 10% of patients had to stop reading due to transient problems in their eyesight. 7% of those returned back to reading, and again, one or two of those patients we were unable to capture at follow-up. So we didn't know whether or not they returned back to reading or not. But again, going back to their visual acuity scores, all of these patients' visual acuity returned back to baseline. So one would assume that they were able to read. So in summary, what we determined was that overall, the general quality of life was maintained on belantamab mafodotin in DREAMM-2. There was improvement in fatigue, bone pain across the board. We did see reductions in functional status for their eye function, but of note that those patients who had a deterioration in their eye function, their overall global health status was maintained throughout. And so I think what this means is that this treatment was manageable and patients did tolerate the treatment reasonably well, but it's very important that there is close liaison between hematologists and ophthalmologists to ensure that their quality of life is maintained.